Welcome to Book Buzz Reviews and Summaries, where we're about to delve into a book that sheds light on a condition often misunderstood, yet profoundly impactful on those who live with it. Disjointed by Jovin is a lifeline for anyone navigating the complex and often bewildering world of hypermobile Ehlers-Danlos syndrome, HEDS, and hypermobility spectrum disorders, HSD. Imagine living in a body where the very fabric of your connective tissue feels like it's constantly slipping away, leaving you vulnerable to pain, fatigue, and a host of unpredictable symptoms. For those with HEDS and HSD, this isn't just a metaphor, it's their daily reality. Jovin, with her in-depth knowledge and compassionate approach, offers not just a guide, but a companion through the labyrinth of diagnosis, management, and treatment. In a world where medical answers can feel frustratingly elusive, Disjointed provides clarity, validation, and hope. This book is essential reading for patients, caregivers, and medical professionals alike, offering insights that can make a real difference in the lives of those affected by these conditions. Join us as we explore the invaluable resources, practical strategies, and emotional support that Jovin brings to the table in this groundbreaking work. Introduction: A journey begins. Imagine waking up every day with the weight of uncertainty pressing on your joints, the invisible threads of pain and instability tugging at your every movement. This is the reality for millions of individuals living with hypermobile Ehlers-Danlos syndrome, HEDS, and hypermobility spectrum disorders, HSD. Jovin's Disjointed offers more than just a clinical exploration of these conditions. It is a deeply personal journey into the labyrinth of diagnosis, treatment, and daily management of a misunderstood and often overlooked set of disorders. From the very first page, Jovin's narrative pulls readers into a world where the body's resilience is constantly tested, where strength is found not in rigid structure but in the flexible determination to live fully despite the challenges. As you turn the pages, you are not just learning about HEDS and HSD, you are living it alongside those who face it every day. Chapter 1: The Early Struggles, Seeking Answers. Jovin introduces us to the initial struggles that many face when symptoms first appear. The journey often begins with vague pain, unexplained injuries, and a growing sense of something being off with the body. This chapter details the frustrating and often fruitless search for answers, as patients navigate a medical landscape that frequently dismisses their concerns. The narrative is peppered with real-life stories, making the reader feel the emotional and physical toll of these early days. The author's use of first-hand accounts paints a vivid picture of the desperation that accompanies the quest for diagnosis. It's a journey marked by doubt, both self-imposed and from medical professionals, and the isolation that comes with having a condition that doesn't neatly fit into the boxes of traditional medicine. Chapter 2: A Diagnosis Unveiled, Relief and Fear. Finally receiving a diagnosis is a moment of both relief and fear. Jovin describes this turning point with a delicate balance of hope and trepidation. For many, the diagnosis of HEDS or HSD is bittersweet. It provides a name for the myriad symptoms they've experienced, but it also confirms the chronic nature of their condition. Jovin takes us through the emotional landscape that follows a diagnosis. There's a sense of validation, but it's quickly followed by the daunting realization of the lifelong management that lies ahead. The author doesn't shy away from the complexities of this moment, exploring both the empowerment that comes with knowledge and the overwhelming nature of the challenges that accompany the diagnosis. Chapter 3: Navigating Treatment, A Maze of Options. With a diagnosis in hand, the next challenge is navigating the treatment options. Jovin delves into the complexities of managing HEDS and HSD, offering readers a comprehensive look at the various approaches available. From physical therapy to pain management strategies, the book explores the trial-and-error process that often defines the search for effective treatment. What makes this chapter particularly engaging is the way Jovin interweaves personal stories with medical insights. Readers are not just given a list of treatments, they are walked through the decision-making process, feeling the highs of finding something that works and the lows of treatments that fall short. Jovin's narrative is a testament to resilience. Despite the challenges, there's a thread of determination that runs through the stories she shares, a determination to find what works, to keep going even when the road is rough. Chapter 4: The Daily Reality, Living with HEDS and HSD. Perhaps the most powerful part of Disjointed is its exploration of the daily reality of living with HEDS and HSD. Jovin captures the small victories and the significant struggles that define life with a chronic condition. She provides a window into the daily adaptations that are necessary, from using mobility aids to adjusting one's lifestyle to accommodate the condition. The author's empathetic approach shines through in this chapter. She doesn't just tell the stories of those living with HEDS and HSD, she makes the reader feel their experiences. The narrative is rich with details that bring the reality of these conditions to life, making it impossible for the reader to remain a passive observer. Jovin also touches on the emotional aspects of living with a chronic condition, the frustration, the fear, the moments of despair, but also the strength, the hope, and the community that many find along the way. It's a balanced portrayal that respects the complexity of these experiences. Chapter 5, The Role of Support, Finding Your Tribe. One of the central themes in Disjointed is the importance of support. Whether it's family, friends, or a community of others living with HEDS and HSD, support plays a crucial role in managing these conditions. Jovin emphasizes the need for understanding and empathy from those around the patient. This chapter is particularly moving, as it highlights the transformative power of support. Jovin shares stories of individuals who found their strength in others, whether through online communities, support groups, or simply the unwavering support of a loved one. It's a reminder that while HEDS and HSD can be isolating, no one has to face it alone. Jovin also addresses the challenges of finding support, particularly in a world that often doesn't understand these conditions. She offers advice on how to educate others and build a network of support, making this chapter both inspiring and practical. Chapter 6, Advocacy and Awareness, A Call to Action. Disjointed is not just a book about living with HEDS and HSD, it's also a call to action. Jovin uses her platform to advocate for greater awareness and understanding of these conditions. This chapter is a rallying cry for change, urging readers to take action, whether by raising awareness, advocating for better medical care, or supporting research. Jovin's passion for advocacy is evident in her writing. She makes a compelling case for why HEDS and HSD deserve more attention, not just from the medical community, but from society as a whole. This chapter is both empowering and motivating, leaving the reader with a sense of purpose. Chapter 7, Looking Forward, Hope on the Horizon. The final chapter of Disjointed offers a sense of hope. While HEDS and HSD are chronic conditions with no cure, Jovin emphasizes that there is hope on the horizon. Advances in medical research, growing awareness, and the resilience of those living with these conditions all point to a brighter future. Jovin closes the book with a message of optimism. She reminds readers that while the journey with HEDS and HSD is challenging, it is also one of strength, community, and hope. The book ends on a note of empowerment, encouraging readers to continue the fight for better understanding, treatment, and support. Conclusion, a journey shared. Disjointed is more than just a book, it's a shared journey through the complexities of HEDS and HSD. Diana Jovin has crafted a narrative that is both informative and deeply personal, drawing readers into the world of those living with these conditions. Through her storytelling, she offers not just knowledge, but empathy, understanding, and hope. This book is a must-read for anyone seeking to understand HEDS and HSD, whether they are living with the conditions themselves, supporting someone who is, or simply seeking to learn more. Jovin's compassionate and insightful narrative makes Disjointed a powerful tool for awareness, education, and advocacy. Read the book to learn more, and if you enjoy my content, consider subscribing to support the channel and stay updated on future uploads. Thank you.